I'm Xavier Richardson, Senior Vice President of Mary Washington Healthcare. I also serve as a mentor to hundreds of students here in the Fredericksburg City Public Schools and serve proudly as the President of the Fredericksburg Education Foundation. Mental wellness is very important to me on multiple levels. Professionally, as you can imagine, being a member of the cabinet of the largest healthcare system here in the community, I have a keen interest in mental wellness and well-being. It is very much tied closely to physical health and well-being. We provide services to many persons throughout this community, and we have enjoyed a great partnership with Fredericksburg City Public Schools. In the past, we have funded a number of initiatives relative to mental wellness, and in particular, the Fredericksburg Head Start program, helping them to abide by their unfunded mandate to provide mental health services to the youngest of the student body, youngest students in the school system. From a personal perspective in terms of my community involvement and mentoring, mental wellness is very important, and it's something that oftentimes young people don't realize the importance of it because they often are only talking to themselves. So whenever I engage in a conversation with a young person, I'm always asking, how are you really feeling? As opposed to simply, how are you feeling? Because typically, a student will only answer at what comes immediately to mind. But I force them to really answer the question so that I can determine whether or not something is not right with them. And I also ask them after that, what is your real story? Tell me about your background, so I can understand the lens from which you are looking at life and the way that you respond to things within your environment. And it's amazing that most of these young people have never had the opportunity to share with anyone how they are really feeling or some of the aspects of their stories. And in talking to them, I can provide them with a different perspective, provide them with some advice, and to encourage them often to seek professional assistance because it is something that does require sometimes some professional services. I tell them that talking to a counselor is just like having a conversation with someone and just sharing their perspective and the importance of telling the entire story. I know that sometimes there are traumatic events in one's life that can trigger things that could cause an imbalance relative to mental wellness. And I think that we all have had a traumatic experience that we all have been undergoing, that being the pandemic. And so therefore I know that there's greater need for mental wellness, and we need to find ways to ensure that all of our population, all of our students, all our faculty and staff, because I know that when I've gone out to the community to talk about mental wellness to school systems and the need for services, oftentimes I'm thinking they're talking about the need of services for students, and they actually are talking about teachers and staff. And I think that sometimes we take for granted that everyone is mentally well, when in fact there are many things that they're dealing with themselves, with the pressures that our young people are facing, and just being responsible for young people oftentimes is a challenge, and sometimes they take on some of the things that the students that they're teaching. So faculty and staff are definitely in need of mental wellness support. I also have a very keen interest in making sure that our underserved populations, our economically disadvantaged students, our students of color who historically have not had access to mental health, behavioral health services, that we make sure that they have access to these services as well. I think that the schools have done well by partnering with a number of organizations and bringing them in to provide services to some of the students who may have be on Medicaid or FAMUS. But we need to make sure that every student is at risk. When we talk about at-risk populations, I believe all students are at risk because everyone has something that that's a challenge to them. So let's not leave. We talk about leaving no child behind. Let's make sure we leave no child behind mentally in terms of wellness. So take time and ask everyone you come into contact with, how are you really doing? And when you have the opportunity, spend some time to find out their real story and understand the lens from which they're looking. Because perspective is also often driven by where you're looking from what lens you're looking from. We often talk about a beach ball, and the color of a beach ball is really dependent upon which angle you're looking at. It could be red, it could be white, yellow, blue, or whatever. And we need to be sensitive to those diverse perspectives and be welcome to be sensitive to culturally appropriate mental wellness services and opportunities for students from diverse backgrounds. I'm often asked, how has the pandemic affected the students that I mentor? I've mentored over 7,000 students over the past 30 years, and I have many students in the Fredericksburg City Public Schools that I mentor. And I will tell you that I miss them. I miss being able to come into the school and walk the halls and have real conversations with these young people. And so therefore, I don't know what they're going through. I don't know the impact of the pandemic on them and the fears that they may have, the insecurities they may have, the things that they have missed. So that has had a profound impact on me, and so I'm now more driven to reach out to them, to have teleconference sessions with them. People sometimes think my conversations are more like a counseling session, but that's beyond my pay grade. But I do miss talking to them because I know that many of them have a lot of concerns that we're not aware of, and we're doing the very best that we can do in terms of operating under the restrictions of the pandemic, but we also need to be mindful that mental wellness is ever more important now than it's ever been before.